We all know that the health sector is a labor-intensive sector, and that the type of labor that it engages are also highly trained labor. What this then means is that as a health sector, we are one of the key sectors that contribute to the wage bill. About 40% of the country's workforce is actually in the health sector. And this 40% workforce in the health sector consumes 70% of the recurrent health budget. There are a number of reports, especially in the health sector, that have looked at the health sector. I think most of you will recall the SDI report recently and the problems that it highlighted, including the problems of absenteeism.
In 2013, we had 38 billion, that's what we were using, but we went to 108 billion. As you know, around this area is when we devolved, so the counties also did a lot of employment. We also have seen in our study the other day the absence of 52.8%. We have had strikes. I think Education told us the other day we took over from them. And since 2011 to 2018, we actually lost 446 days. You can calculate the salary amount of money that we lost. The overall objective was that we were to explore the health workers' performance and productivity in Kenya and establish ways of integrating employee productivity in order to manage wage bill. We lack a measure for productivity in health sector. Because you can tell me if a neurosurgeon doesn't conduct the surgeries because the theater nurse is not there or the equipment are not there, you may not put that on the neurosurgeon. Health works as a unit, so it's very difficult to measure. We actually increased our health worker per 10,000 from 5% core health worker to 8.3. But actually for UHC, we need to go to 44.5 per 10,000. We are saying we are going to do that tomorrow, but that is the optimum. Now coming to, so is it that we don't have health workers? Coming to the absorption, we find that the rate of absorption for nurses is 53%. Doctors, medical officers, 78%. It used to be 100% if you remember. We finished internship and they were absorbed. Clinical officers 65%, giving you a total, an average of 58%. So what we are saying is that it's not that KMTC and the universities have not trained, but they have not been absorbed. At the same time, we have about 7,033 31 that are about to retire by 2023, with Laikipia having the highest and Madeira having the lowest at 3%. Now, the other indicator we said for productivity is absenteeism. But now, what do we mean absenteeism? This absenteeism was actually those who were not there and were supposed to be there. But sometimes we also look at absenteeism in terms of who should be there and has not been employed to be there. But the other thing in absenteeism is to look at what is also called presenteeism. Because you might have people there, but are they working? So you should avoid presenteeism as you are trying to curb absenteeism. In terms of impact of health outcomes, the initial analysis also shows that increasing employed health workforce by 1 per 1,000 is associated with additional 7.7 years of life expectancy. Life expectancy, if it is high, then you increase the economy, you will not have people, you will have people who are working for longer. And then also, if you increase the density, 1 unit per 1,000, Over 10 years, it has been shown that it's correlated to at least 41% growth in GDP. And also return on investment. For every $1 you place in health workers, you gain 9. So having gone through that, we came up with some recommendations or policy options. So one of the options is, can we develop and implement a multidimensional productivity index? So that when we assess, we are assessing the correct way. And this would require that we have an in-depth study of health workforce productivity. We develop the tool, we link it with the performance, and then do we reinvent performance management? Are we able to do the talent, embrace talent roundtable? Building the talent, mentoring. What we are saying is that health sector has multiple interdependent variables linked to other system building blocks, such as quality of service delivery, which complicates the equation of productivity. And therefore, we need an in-depth regression analysis to establish the relationship between multidimensional determinants of health workforce, productivity, and wage bill. And then we have also said, what we have learned is that monitoring absenteeism without appropriate supervision could breed presenteeism.
And I think in this exercise of managing the wage bill, it's very important to keep those two elements together. On the one hand, Kenya makes a lot of effort and is progressing towards UHC, and also now we have to better manage the wage bill from the health sector. In Kenya, and the presentation showed there are efforts to be done, there's a potential to improve productivity and performance that will hopefully lead to a better management of the wage bill, but at the same time, internationally, Kenya compares pretty well. Overall, if we look at different countries, there's not a single magical formula for measuring productivity. I think every country really needs to find their own way to see how best we should measure productivity. My suggestions would be, it'd be good that there are some common elements among those sectors for measuring productivity and performance, to have a kind of benchmark or a similar way to go, at least to some points. And then, of course, each sector has some specificities, but this is really an opportunity to improve performance and productivity, to say this is a way to invest better in the health workforce. Thank you very much.
Thank you.
So let's applaud Dr. Pascal, Dr. Wamai, and also our CS, Dr. Amana.
I like the presentation my senior Daktari has given here, where he has said no UHC without health workforce, but we'll also add a statement without also healthy workforce. Other than having a healthy workforce, we also need a healthy workforce if we have to consider about the wage, because one of the things that because of burnouts and fatigue, and one of the issues that are coming because of in terms of absenteeism is actually because of the nature of work that these staffs do, and eventually they end up sick coughs and such things. So we also need to address the issues of workers in terms of their health.
We need to begin thinking about how do we achieve excellent levels of productivity. How do we think the question of work climate of the workers? How do we think about teamwork so that we can be able to have productivity? Then we need to begin asking ourselves, are our health workers involved in problem solving? Are they involved in decision making? Are they coming up with the process changes that are occurring so that we can be able to think about the question of improving productivity?
Kenya as a country does not have national productivity measuring center. We have not established one. So we must begin first by establishing national productivity center, which will then come up with the productivity measurement tools. I therefore am naive to agree with the result that health sector has not performed well. It has been declining when we do not have tools to measure productivity, especially in health. About the wage bill, we must look at it holistically. There are factors that must be looked at. A factor like the differential wage, consumer price indices, affordability, comparison both nationally, regionally, and internationally. And therefore, we must also look at the issue of harmonization and human resource management. Thank you.
So I think before we think of employing where we are talking of the wage bill, can we add value to this through training and also putting emphasis on task shifting and task sharing, and finally doing a lot on building communities of best practices? Thank you.
The essence of working hard to be rewarded, I think, does not exist anymore in our country. And most young people aspire to acquire whatever they can in any manner they can. Is that the kind of nation that we want to raise? I think we need to ask ourselves hard questions in that area. We need to be able to instill the proper work ethics so that people realize that when you work hard, you are rewarded, not only monetarily, but you're also rewarded in what you are doing and your service to nature. To Seth Panyako, I want to say that nobody is going to come up and set up their own standards of measurement of productivity. I think these will have to be national standards pegged on global standards that are agreed by all the stakeholders, so that everybody owns it and then therefore accepts the way these standards are going to be implemented.